Among the most common arrhythmias, we have sinus bradycardia and sinus tachycardia. What characterizes sinus bradycardia is actually the increase in length between two consecutive QRS complexes. This usually shows in a way that PR interval is prolonged and even the QRS complex. Otherwise, by definition, a person has bradycardia if the rate is less than 60 beats per minute. If we compare with tachycardia, you can see here that the distance between the two QRS complexes has shortened considerably. Here we can see the PR interval is now 0.14 instead of 0.16, and QRS complex is also shortened to 0.06 instead of 0.08. Otherwise, by definition, a person has tachycardia if the beats go above 100 per minute. But what causes bradycardia and tachycardia? If you see here, we have multiple causes, but the most common cause is actually a state of relaxation, such as in sleep or when you're relaxing in any sort of activity. For cardiac conditions, usually it follows myocardial infarction. Then there's also how athletes are normally trained enough that they have bradycardia. How do you tell if a person has bradycardia? You have to look for these signs, such as hypotension, cool, clammy skin, dizziness, blurred visions. If you see any of these signs, a person may be having a pathological type of bradycardia instead of a normal one. In such a case, the patient should be treated with atropine, and if that doesn't work, norepinephrine.